Sexually transmissible diseases update is a very important subject now because of the widespread of sexually transmitted diseases and the sexual freedom all over the world. The sexual freedom, the earlier onset of sexual activity, and the evolution in contraceptive pattern during the last 4 decades generated a virtual revolution of sexually transmissible diseases. The more effort we try to do to prevent or manage, the more the disease we find. The more difficult the treatment is. It is linked to the most intimate human behavior. How to resist it, how to fight it, it's very difficult. From the classic 5 venereal disease, gonorrhea, syphilis, chancroid, lymphorangioma venereum, and granuloma inguinal, the number of sexually transmissible disease agents have grown to over 25 diseases. The risk of transmission is growing from couple to contacts, newborn, and healthcare workers who deal with such cases even. The sexually transmitted pathogens in the form that we have bacterial agents, Neisseria gonorrhea, chlamydia, trachomatis, and so on. We have the genital mycoplasma, Mycoplasma hominis, and ureorectum. We have the fungal agents. We have viral agents. There are many. The most dangerous of them is herpes simplex virus, human papilloma virus. Then we go to HIV and others. The protozoal agent Trichomonas vaginalis, and Lambia, and ectoparasite pediculosis pupis and pediculosis caviari. And we have diseases ranging from them, for example, acquired immune deficiency syndrome, HIV, from immune deficiency virus, pelvic inflammatory disease, multiple bacteria affecting female lower genital tract infection in the form of vulvitis vaginalis and all genital organs, lower genital organs, male genital tract in the form of psoriasis, specific and non-specific epididymitis, proctitis, and so on, genital ulceration, hepatitis, acute ulceritis, and enterocolitis. The prevention of sexually transmissible disease is very difficult and very interesting subject. We have body resistance to infection, which try to counteract infection in all parts of the body. For example, the digestive system, we have the difference in pH from alkaline in the mouth to the acidic in the stomach, then to alkaline in the intestine. This kills many organisms. We have the enzymes that's present in saliva and in the stomach, and also in the intestines that kills many organisms also. And the very strong HCl in the stomach kills many organisms. The respiratory system, the difference between temperatures between outside and inside kills the organisms. The cilia, which can hang bacteria and things from getting in. Cough and sneezing, which spells out many things. Of course, the urinary system, the pH of the urine is acidic, which this is resistant to infection. We have lysozymes and isozymes in urine and so on. The digestive system is unique in resistance to infection. We have the vaginal pressure is higher than the atmospheric pressure, so nothing can enter. And the cone shape of the vagina makes the vagina pushing everything out, not getting inside. The cervix is closed with a mucus plug. And the uterus, its pressure is higher than the vaginal pressure, so nothing entered except if there is no mucus plug and this space is open around ovulation. Also, the fallopian tube, the pressure in the fallopian tube is higher than the pressure in the uterus. Sperms can't enter inside the fallopian tube except around ovulation and during the phase of gestation of the tubal ostia. The peritoneal pressure is higher than the tubal pressure. This all prevents anything from coming down up, but things come from up to down, sperms can enter when this is all comes in a state of equilibrium in the pressure, which allows the sperms to mount to reach the ovum. Innate immune response also helps to counteract any bacteria to go. The microbiome, which changes the pH inside all this area, helps to the acidic pH, for example, of the vagina itself, and then the alkaline pH of the cervix, and the immunoglobulin present in this mucus, IgG and IgE, all this counteract vaginal infection. The innate immune response is recognized microbiota through pattern recognition receptors, which are receptor-specific for molecular components of the microorganisms. It has these molecular components has its own space in DNA which can recognize them in order not to attack them for the microbiome of the body. Those coming from out, they are considered foreign and they have to be attacked. It's the first line barrier and the rapid mechanism to prevent microbial invasion. It starts sooner before cellular response, T cell and the humoral response. The microbiome, the collection of bacteria, fungi, and viruses that live in and on the body, may also be considered a component of the innate immune system as it profoundly impacts mechanisms of host defense. When couple marriage, they have the same almost microbiome, which means they can accept each other regarding microbiome living in the vagina and in the male genital organ, in the mouth, and so on, and that's changed by a method. Nothing changed in the DNA itself, but it's an epigenetic changes. The body microbial composition directly influences the maturation of immune response and its continued effectiveness, protects against pathogen overgrowth, and manipulates the balance between inflammation and the immune homeostasis. For example, skin microbes interact with immune system to promote wound healing. Lactobacilli is very important. Fecal microbiota transplantation is an effective method of treatment of ulcerative colitis. It's very important in management of ulcerative colitis. The primary prevention is directed to, number one, prevention of the disease in the future patient, the contact and the treat infected individuals. Either we abstain from the sexual intercourse. If we have an infected individual, he has to stop until he is treated. And the contact also has to stop until we confirm either he is infected or not. Monogamous relationship, sexual relationship inside marriage. This decreases the level of sexually transmissible diseases. Prevention, some drugs can prevent when exposed. Some vaccines like hepatitis B, for example, and A. And the barriers as male condom and the female condom. Vaginal spermicide has some values, and also cervical barriers. Regarding couples, the probability of transmission per act of sexual intercourse is different regarding each virus. In HIV, this is the least chance. In hepatitis, herpes simplex, and hepatitis human papilloma virus, of course, this is transmitted through stratified squamous epithelium. Just contact to each other can transfer infection. Hepatitis B, no controlled status, but if not immunized, it can be transferred. Hepatitis C, lack of protection, and also we found the same genotype in the couple when one is infected. Female condom is highly protective as it covers the whole female genital area. Bacterial barriers that kills and others can prevent or decrease. For example, if we use spermicide and non-xenonide, it can kill some bacteria and some viruses. What about vaccination for prevention of sexually transmissible infections? It is present for prevention of several infections that are sexually transmitted, associated with sexual activity. Hepatitis A, B, HPV, also against Neisseria meningitis. Neisseria meningitis is used, but it has to be repeated, not to be all over the life. But hepatitis A, B, and HPV can be given just once. Individuals with advanced immunodeficiency may have an impaired response, so they have to take repeated doses of vaccination. BCG vaccination proved to be very successful during the COVID infection, and it makes some kind of enhancement of the immune system and the innate immune system. That's why it can be given to such people who has been exposed to sexually transmissible diseases in order to decrease level of transmission of these diseases and their resistance. Epigenetics also, all body have the same DNA sequence which carries the organism to entire genome, but epigenetics means changing the action of the DNA without changing DNA sequence. It is very important as it accepts some microbiome inside the body, but it doesn't accept any foreign infections that comes to or affect any woman from sexual act. What happens after exposure? If somebody exposed to sexually transmitted disease, we have the screening for others, for prophylaxis, health care workers, then we go to treatment. Screening all individuals attending sexually transmitted infection, of course they are exposed. All patients with another sexually transmitted, any patient come to a clinic and she's having one sexually transmitted disease, it means she has been exposed, and we have to search for other sexually transmitted diseases, recurrent vaginal discharge, others, many as we can see before IVF also it is better to screen for sexually transmitted. Prophylaxis, when someone is exposed, number one, we give prophylaxis against Neisseria gonorrhea, chlamydia trachomatis, trichomonas vaginalis, and syphilis. Ceftriaxone 125 milligram to one injection intramuscular, this is for gonorrhea, azithromycin 1 gram or doxycycline 100 milligram twice per day for 7 days for prevention against chlamydia mycoplasma. Metronidazole 2 gram once for both couples. Penicillin 2.4 million units can be given. HIV, many antiretroviral drugs for 28 days. Hepatitis B, it's lucky enough it has a vaccine. HPV having a vaccine. Herpes simplex, we can give immunoglobulin if the patient is not infected before. HCV, we can give immunoglobulins also. Zika viruses, we have to avoid contact for 12 weeks because if the man is infected, it continues in the sperms for 12 weeks. Regarding viral infection, either if the patient is negative, we protect by immunoglobulins or giving vaccination and retest after 3 to 6 months. If positive, we immune or infected, we confirm. If immune, no treatment. If positive, we give the treatment of infection. The management, the care of HIV positive women or other viral disease requires a team consisting of experts in virology and obstetrician and pediatrician for the mother and the husband and the coming newborn. During pregnancy, the risk of vertical transmission rises when the viral load is increases. If the woman, for example, with HIV not treated, the rate of transmission 15 to 45%, rising up to 70% at delivery and 30% in utero. If treated according to timing of delivery, the risk may be 1.6%. During pregnancy, we can give some antiretroviral drugs. During delivery, it's better we deliver by cesarean section in HIV, in human papilloma virus, and the herpes simplex virus also. We avoid premature natural rupture of membranes. If normal vagina is mandatory and we can't stop, so no intervention, no forceps, no other interference. Lactation, the risk of transmission in lactation increases to 14% in HIV. Also in hepatitis C, the risk is increasing, and hepatitis B, that's why we give hepatitis B vaccine neonatal. And the newborn is washed with saline just after delivery and antiseptic. We have many measures to decrease the risk of cesarean section. Anyhow, we must have viral load to be increased in order not to increase the risk of transmission. The healthcare workers have to take care from needle or any other use with sharp or any other injury with sharp objects. It's very important to prevent transmission of the infection. Body fluids that can transfer, most body fluid can transfer, and some might transfer or not, like breast milk, urine, sputum. Breast milk doesn't transfer, but if the mother is having abrasion and the blood, it can transfer to the newborn, for example. At least one blood exposure can document in over 30% of surgical procedure. More than 70% of surgical procedure, there is blood exposure to healthcare workers, 70% of which may have been preventable if we take care from the guidelines to prevent such injury from instruments. To reduce exposure with sharp instruments, we have have guidelines, it is very important to apply in order not to decrease, to increase the risk of transmission to healthcare workers. Of course, the treatment of sexually transmitted disease, it's very important to have to use the least drug and the least doses, and we might give the patient just inside the clinic to make sure he has got the treatment. This is very important. Then we have to call for the couple and to give him. Drugs selected for treating should fulfill the following criteria. Highly effective, at least 95%, low cost, that's why, for example, efficacy cannot have been removed from treatment of gonorrhea and sexually transmitted disease because we have resistance many places in the world. Low cost, acceptable toxicity, single dose as much as possible. For example, azithromycin is better than tetracyclines in chlamydia and mycoplasma. Oral administration as much as possible, no contraindication. Organism resistance is unlikely to develop. Azithromycin and clarithromycin have a broader spectrum of activity, and now they have entered in the guidelines for many things. They affect many gram negative anaerobic, atypical, and the mycobacterial organisms also, and many gram-positive organisms besides several atypical organisms. Azithromycin is active against mycoplasma, genitalium, Haemophilus ducreyi, chancroid, Klebsiella granulomatosis, granuloma, which causes granuloma inguinal, chlamydia trachomatis, and Neisseria gonorrhea. So it is used in treatment of sexually transmitted infections very successful. Azithromycin also is used in syphilis according to geographic area due to some resistance development. So if we came to syphilis, penicillin G injection, 2.4 million unit intramuscular once, doxycycline 100 milligram oral twice per day for 14 days, or tetracycline 500 for 4 days. We come to ceftriaxone and amoxicillin also can be used. Pelvic inflammatory disease, we have 3 regimens for pelvic inflammatory disease, but for patients with mild to moderate PID who are treated as outpatients, ceftriaxone is given at a single dose intramuscular, then plus doxycycline 500 milligram oral twice days for 14 days. And if we suspect anaerobic, we might add metronidazole grade 2C as 500 milligram twice per day for 14 days. To conclude, sexual transmissible disease is updating is very important, and we update every short time. Vaccination against HPV doesn't prevent the infection with other strains of the virus, and it doesn't mean full protection against cancer cervix, but this is very important because we have some other reasons for cancer cervix, but it's very important to decrease the risk. Many factors exposed to cancer cervix, as mentioned. Male condom doesn't prevent many sexually transmissible diseases and not a suitable method for contraception. If used alone, at success rate about 60-65%, it has a higher failure rate. Exposure to one sexually transmitted disease means the risk of infection with more than 20 viral, bacterial, and protozoal. Once a sexually transmitted disease is discovered or a case of accidental intercourse outside marriage, more than 5 drugs has to be ingested at once with screening for other viruses and other bacteria. Zika virus and its virus family like chikungunya virus and West Nile fever virus are sexually transmitted and can be excreted in semen for 3 months or more after exposure. Oral and orogenital sex can transmit many sexual infections, especially HPV for the larynx. Many sexually transmitted diseases are asymptomatic, but more serious pelvic and peritoneal disease may appear later. Women are more born to sexually transmitted than men. The rate of transmission from men to women is 3 to 1 and the vice versa. Women share cell strains of organisms with their single partners that gives them a kind of resistance, means sharing microbiome. Many sexually transmitted diseases are now resistant to various conventional drugs. What to do, how to prevent, what about vaccination, how to treat? These are the questions all the world is studying now and trying to overcome this plague that's coming out and trying to overcome the sexual freedom all over the world. Certain sexually transmitted as gonorrhea, syphilis, HIV, and others are more readily transmitted than others. Sexual practice plays the most important role. In simple words, prevention is better than cure. No safe sex is available outside marriage. No barriers can protect. Enough vaccines are not available. Tell your patients to go home, sleep in your bedroom, thank God for your wives and husbands, love them tenderly because safe sex is unavailable outside. Thank you.